See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist Shauna Butler.
During this pandemic, our teams were there on the front lines in our communities, and it was about being agile, being innovative, willing to be bold, take some risks and learn as we go. On average, 40% of patients who present to MinuteClinic for care do not have a primary care provider. Part of the work that our nurse practitioners do is to support them in getting connected back in to the primary care system. My job is to care for those nurses, those providers, as they care for our patients. And the way that I care for them, think about them, work to put things in place to support them, will always be reflected in the care that they deliver to patients. If we're able to make things easier in the community where our patients are living and working and shopping, ideally, it's a better experience that leads to more engagement, more of a sense of caring, and ultimately improves their health and well-being.
Welcome to See You Now. I'm Shauna Butler. COVID-19 precipitated an avalanche of disruption and crises felt in every corner of our healthcare systems. Ones that included disruptions to accessing and delivery of healthcare, organizational and supply chain disruptions, and brutal workforce crises. And while the pandemic has been a devastating disruptor, it's also unleashed an unprecedented demand for bold moves in a learn as you build, take some risk, healthcare transformation sprint, one that, in crucial and impressive ways, saw nurses fuel and lead. And it is critical that the momentum and consequential gains of nurse-led innovation not be lost, that they are urgently shared with leaders, decision makers, and change agents to be swiftly and confidently ushered into organizations, adopted in our practices, and benefiting our workforces. And that is precisely the intention and opportunity of one well-researched and authoritatively written report. In this third episode of our Reporting Power series, we're centering on the Accelerating Nursing, Transforming Healthcare report, inspired equally by the pandemic's tidal wave of anguish and innovation, and published as a collaboration between Johnson & Johnson, the American Nurses Association, and the American Organization for Nursing Leadership. This report is a significant and timely body of research offering a compelling narrative about the sudden and massive changes to care delivery, organizational structures, and our healthcare workforce. The report is written with a determination to preserve and advance the innovation and accelerate the momentum and transformation, even while we are still responding to the challenges of this pandemic. While there's been an abundance of reporting about COVID's siege and impact on hospitals and acute care teams, there are other settings and care teams who've also experienced a shock to their systems, operations, and clinicians. Non-acute care, routine care, non-COVID care. They've too felt the pandemic's seismic disruptions, and its demands have pushed them into high gears of experimentation, innovation, and transformation as well. In this episode, we go for a checkup at our local retail clinic for a close-up look at how purpose-driven organizations, leaders, and teams have responded to the healthcare needs of people and communities across the nation when a global public healthcare crisis called upon their unique capacity, resources, and partnerships to meet a pandemic-sized gap in care.
Hi, I'm Angela Patterson, and I'm the Chief Nurse Practitioner Officer for MinuteClinic. In my role, I lead our organization's more than 3,000 nurse practitioners and PAs in more than 1,500 nurses who staff our more than 1,100 clinics across 35 states and Washington, D.C., as well as provide care through our virtual care platform. Patients can also access a MinuteClinic care visit through our eClinic virtual care platform, which spans across 49 states.
Wow.
Mm-hmm.
You're everywhere.
We're getting there. Great to have a team of nurses.
How do you describe the MinuteClinic experience? And, who are you serving and what do they love and appreciate about coming in and getting their healthcare in a MinuteClinic experience?
Yeah. Shauna, not only does our logo include a heart, but it embodies a concept that is part of our company purpose, which is bringing our heart to every moment of your health. And when I think about the MinuteClinic nurses and what they do every day, they have the patient in their lens. It is about caring for our patients, certainly with quality, but also with empathy and compassion. And I see this being lived out every day in our practice. And it is really so inspiring. And even the inception of MinuteClinic and even the idea of retail healthcare 2 decades ago was really around what is the healthcare consumer asking for in their healthcare experience at that time. And it was really around convenience, access, affordability, certainly around quality, but also caring, empathy, education. All of those things really became part of the MinuteClinic model. Transparent pricing, being open on weekends and evenings and most holidays to be there for our patients when they need us most. Those Sunday mornings when your child wakes up and has a fever and an earache, or if you're traveling, or if you're a grandparent with your grandchild and you can't access the pediatrician, and having an alternative other than the emergency room to receive quality care is so important. And it has been so wonderful to be part of bringing this to our healthcare delivery system nationwide. Overall, we see our role as delivering complementary primary care. And we work to fill gaps in care between annual visits or for patients who've fallen out of care. Perhaps they've moved or their primary care provider has retired. We also know that many patients who come to see us don't have a PCP, and working to help connect them back into the primary care-based health system is another way that we deliver the kind of care and the advocacy and support that patients need.
There were a couple of things that you said that I want to have you follow up on. How many people do not have a primary care provider, a practice, a home? When you talk about this being a national practice that fills in the gaps, for many people, I think you probably are serving as their primary source.
On average, 40%, and in some regions, maybe higher, 50% of patients who present to MinuteClinic for care do not have a primary care provider at that time. And part of the work that our nurse practitioners do is to not only ask that question, but also to support them in getting connected back in to the primary care system.
You reference nurse practitioners and you talk about the team. How do you comprise your team and build each one of these clinics?
Within the MinuteClinics, our care is delivered by either nurse practitioners or physician assistants in some states. Over time, our healthcare team within the MinuteClinic have moved to not only provide immunizations, assess and care for minor injuries or illnesses. As our services have expanded, we've included nurses in many of our locations as a part of our healthcare team. And our nurses help support our nurse practitioners and PAs in care delivery. They also support our screening programs as well as things like diabetic retinopathy screening. In our health hub locations, where there's greater integration between the retail, pharmacy, and MinuteClinic, we've added healthcare concierge who helps consumers navigate their experience. I think if we're able to make things easier in the community where our patients are living and working and shopping. Ideally, it's a better experience that leads to more engagement, more of a sense of caring, and ultimately improves their health and well-being.
Yeah. As you mention all of this, I'm thinking the media has really done a lot of work educating people about our healthcare systems. And predominantly, it's been focused in hospitals in these dire and really acute care situations. Fortunately, the vast majority of people are not in hospitals, but they still need a lot of care. And it's in the communities and it's in places that are in their neighborhoods. I'm curious, with all of the clinics, you have, and in so many different communities, you reference having this national footprint, and you guys have been part of the essential services that have had to stay open when other things were closing. What are some of the things that at the community level, the people who are non-acute care, what are the problems that have been coming through your doors and your clinics that maybe we haven't heard about? And then more importantly, your teams have had to swiftly change and innovate to address and solve them.
We were providing care for minor acute illnesses and injuries and vaccinations and so on. And then we quickly learned that the needs of our patients were changing as a result of the pandemic. And we focused on a couple of things. One was to quickly ensure the safety and well-being of our clinical team on the front lines. And then secondly, being there for our patients, responding to their changing needs and being there for them. We also understood that people weren't comfortable with leaving their homes, but still needed care. So we stood up a rapid response with our e-clinic service to enable patients to connect virtually with a MinuteClinic provider. People were delaying or putting off care. Being able to have an initial assessment or a full appointment virtually provided that opportunity. The other thing that we did was we stepped up to provide COVID-19 testing services very early on in the pandemic. And we continue to provide that service to this day, as well as the COVID-19 vaccinations. And, throughout this time, our providers were sources of information and comfort for many patients. Our patient care delivery teams were there on the front lines in our communities during this pandemic. And I'm super proud and inspired by it.
Yeah, it's been remarkable when the vaccine was first available. And we made this commitment that our oldest Americans and those who have been living in nursing homes, that they were the ones who were getting the vaccines and recognizing this is a particularly special challenge. They're not mobile. They can't get out to clinics. And you had teams of pharmacists and nurses who were going on site. I mean, that was like a very short time to ramp up these teams and then figuring out just like, where do we find people?
Absolutely consistent with our purpose. A very purpose-driven leadership that cascaded to very purpose-driven healthcare professional teams, our nurses, our pharmacists, our retail partners, everyone committed and working together to make this happen quickly, and then continually learning and receiving feedback from our colleagues, as well as our patients and other partners within communities around how do we do this, and just an iterative process. But I think it starts with the commitment to be there, be a partner in health, not only internally, but with local authorities and others to bring to bear resources and the people power to address the health need at the time, as well as help folks get back to care. Folks who've delayed care throughout the pandemic, and just an ongoing parallel piece is being there to deliver those services, to meet patients' healthcare needs, both COVID-related and non-COVID related. And one of the things we did at MinuteClinic during the pandemic earlier this year was launch our mental health services pilot. So in select locations, we're now including staffing with licensed family therapists, social workers to provide on-site mental health services. And we're continuing to build out that pilot and learn from it. And I think that's just an example of responding to the healthcare need at hand, and also continuing to build upon our purpose to meet the healthcare needs of our communities.
You bring up two really important points, and there's been so many important reports that have been released assessing our situation within our health systems, within the professions, the workforce, the Future of Nursing report. And then also there's the Accelerating Nursing, Transforming Healthcare report, and many others. And they're making some really powerful recommendations. And one of them is preparing nurses to respond to disasters. And so there have been great examples right now in COVID and some other natural disasters. You know, your teams are so critical on the front end because of this national footprint, because of the size and the scale and the skill mix that you have. When we say that recommendation, preparing nurses to respond to disasters, okay, what does that mean? You know, what needs to be done in order for nurses to be prepared to respond to disasters?
I think part of it is certainly ensuring that we're incorporating into education and curriculum and organizational structures, formal pandemic planning, incident command planning, and mock drills, and ensuring that a skill set, that knowledge, as well as that discipline in preparedness planning is happening at the academic level, as well as in the organizational level as part of our strategy and business planning. The other piece is continuing to support nurses to be agile and flexible relative to strategy and to learn as we go, especially for an example for us is setting up the COVID-19 large tent testing sites. In pandemics, many times decisions need to be made swiftly and there's less data and less history that would give you best practices in certain situations. And
I can give you some great examples. I was part of these I was part of these pop-up clinics, and we're doing them outside in this incredible heat where there's no electricity, no running water. We've got lines of cars, and we're trying to figure out traffic safety. Okay.
Exactly.
So I've done a lot
Who
of different
thought
things.
That would be part of your work? Exactly.
Yeah, trying to figure out how you administer a test when somebody's in a seatbelt in a car, you know? And,
exactly.
And you've got your gloves on and you're trying to do this off of iPads. And do you have Wi-Fi? I mean, like, the test was not the hard part. It was the logistics.
Everything else. Yes. And it's so exciting and creative and innovative to come up with design ideas. And it's actually just such a learning experience to see how many things need to be considered as you're planning and designing healthcare programs and delivery systems and initiatives. It all matters. The learning as you go, the continuous and dynamic feedback, conversations, and process improvement, being agile, having your A plan, but then also having your B, C, and sometimes your D plan if things go sideways is an important part of it as well. And having those things help you to do amazing and remarkable things. Like for us, you know, we've evolved from our early large tent testing sites, which I think we had about 5 of them in different states. And we worked together with our pharmacy partners to do testing through our pharmacy drive-through windows. We had standalone kiosks built that sit in our Minute Clinic parking lots where we have nurse testers and folks are able to have rapid COVID testing done through these sites. And we've also worked with a number of partners to support testing in a number of underserved communities. All of that was new. It wasn't a footprint for that. And it was about being agile, being innovative, willing to be bold, take some risks and learn as we go and understand that the need that our patients had was immediate and that learning as we go and being agile was the right strategy. And today, CVS Health has administered more than 34 million COVID-19 vaccines and 32 million COVID-19 tests across the country. So really inspiring and exciting to be part of this work. And I think it really speaks to innovation and growth mindset and really the power of purpose.
We've talked about some of these recommendations, and one of them is preparing and advancing nurses to take on executive roles in the design and the decision, the innovation and the policy. You know, it's one of these really key findings that pretty much every report that comes out in order to address access, equity, quality of care, it reinforces so many times you need to have nurses in these very senior roles. And it's a different skill set. And it comes when you have a very strong clinical acumen and very clear sense of how practice should run. How do you actually take care of people in communities? So you are one of those nurses in one of those roles. And I would love for you to speak to that and talk about what are the ways that you have seen you being in these executive roles making a difference, not only in the health of citizens, but in the health of our communities and health of the country?
Yes. So in my role as Chief Nurse Practitioner Officer for MinuteClinic, my role is to provide clinical and professional practice governance for the more than 3,000 nurse practitioners, PAs, and more than 1,500 nurses who deliver care. And I also support our quality program, our clinical education program, and our workforce development programs. The health and well-being of our nursing workforce is an essential part of my role. So I would say, as part of my work at MinuteClinic, building a pipeline of nursing leaders within our practice is an important piece of the work that I lead and an area that I prioritize greatly. And we support them in developing talents and skills to be able to step into their roles through things like an emerging leaders program internally, learning experiences, stretch experiences, mentorship programs, opportunities for our providers and nurses to develop. I think nurses also bring an incredible level of, and a unique level of compassion and empathy as leaders. One thing I know, just being a nurse for more than 35 years, is that nurses are the keepers of our patients' stories, and their voice is an important part of leadership decision-making. They understand and experience the patient experience and can really speak to it. And I think nurses are tremendous problem solvers and innovators. So when I think about bringing that to the organizational level, it's an incredible talent and an incredible value add to the data, the information that was used to make decisions relative to, how we care for our patients and how we design and how do we handle some of the challenges.
Because of your role in a large publicly traded corporation at the executive level, you get to be in a lot of different business roundtables where there are multiple sectors that are represented. What are your thoughts about other sectors bringing nurses into roles that will help them frame and solve a problem through that healthcare nursing lens that maybe they hadn't considered? And I'm thinking things like technology, our food systems, supply chain, finance, mobility, housing, environmental services. Where do you see nurses in executive leadership roles in sectors outside of health?
I mean, I think teams and outcomes and plans are so much more effective, more robust, richer when there is diversity of thought and inclusion as part of the team, really broadening the lens on the expertise of the team's skills and bringing in different dimensions. I think that is what really stimulates not only the growth mindset, but also adds to the final product in terms of being relevant, being successful, enabling those teams to see all the different angles, including unintended consequences or ways in which this could go sideways. I think nursing lends a very particular lens that should be part of that diversity integrated into teams, especially those creating solutions or new directions for care delivery.
So when people are wondering what is the value and the benefit of making sure that the scope of practice as it relates to state legislation or institutional policies, how is it that we're improving on these metrics of access, quality, and affordability when we do make sure that everybody's working at the top of their skill, their training, and their licensure.
An important part of the solution is that all healthcare professionals, all people along the journey of a patient be fully enabled, that we're maximizing potential capabilities and contributions that a whole range of people can bring to advancing health and well-being. For us at MinuteClinic, we've evolved our practice as we've built the infrastructure. We've been learning, we've been adding services that maximize the capabilities and potentials of our nurse practitioners and PAs, including the assessment and management of patients with common chronic conditions and other services. We've added nurses, RNs, LVNs, LPNs to many of our healthcare teams who can support patients with education, advocacy, in addition to supporting the providers, but also give flu vaccines and care for patients within their scope, education, training, and licensure, or even within our communities. When I hear about healthcare engaging bobbers and librarians in supporting healthcare programs and initiatives at the local level, there's so much that professions and folks who touch people's healthcare can contribute to move people along and improve the health of our citizens and the well-being.
The other recommendation that comes through in every single one of these reports, and you mentioned it, supporting the health and well-being of our nurses, of all of our clinical team members. Our health systems are entirely dependent on our clinical care providers, and our colleagues, they're struggling. We're really in a crisis, and we keep seeing this over and over rolling across the nation, where there aren't enough. The ones who are in the thick of providing care are struggling with their physical, emotional, mental, spiritual health, every dimension. These are system level challenges that are going to require system level solutions. At the executive level, Angela, what are you seeing? This group of folks that you're working with that are leading with purpose. What are the very concrete actions that executive teams are making to address a nationwide, a profession-wide, system-wide problem?
I have no doubt that this is at the top of every nursing leader's, every healthcare organization's agenda. It's a priority. The last year and a half have been so challenging for our healthcare providers and our nurses on the front line. The grit that they've demonstrated, the stamina, in addition to dedication and commitment, they've shown up every day despite personal and professional impacts. Certainly what concerns me is nurses across the country leaving the profession. Fatigue, burnout, their fuel tanks are empty. And as leaders, it is imperative that we focus on how to support the needs of our nursing teams, not just their clinical and operational needs, but helping them to stay resilient, ensuring they take time for themselves and prioritize restoration. I so appreciate this being part of the future of nursing recommendations that we must take steps to ensure nurse well-being. And I believe that there are a number of things that organizational leaders need to be prioritizing and putting into place. And certainly, I'm using the future of nursing recommendations as making sure that I'm hitting on all of these levels and working towards advocating for putting things into place to support nurse well-being, recognizing care for our frontline healthcare workers. So this includes things like ensuring that we're working with our teams to resource well-being programs, including employee assistance programs, support for mental health services, PTO, and working to ensure that our frontline nurses are taking their PTO, things like online fitness and supportive health classes, looking at benefits, including things like childcare and caregiver benefits, programs that prioritize physical health, emotional health, purpose, social connectedness, recognition programs, as well as support for recognizing our nurses who are volunteer and do community work in addition to the work that they do as part of their role, prioritizing behavioral health. The other piece is, to work within the organization to ensure that we're establishing and advancing a culture of psychological safety and ethical practice through organizational infrastructure, policies and procedures, things like preventing workplace harassment and incivility, ensuring that we're creating diversity and inclusion programs. I know at MinuteClinic, we recently launched an enterprise-wide strategic diversity management team to really support diversity and inclusion agenda based on identified areas of opportunity within our organization. And we also need to make sure that, we're collecting data, that we're evaluating the health of our workforce, including retention and turnover and engagement, and ensuring that we have bi-directional communication. We're hearing from our nurses. We're receiving their feedback. What are their recommendations and suggestions for improving their experience as colleagues within our organization? What more can we do? And then lastly, I would say it's important that as leaders, we hold our nursing leaders accountable to our nurse well-being and ensure that that's part of our strategic work, our performance appraisal, our performance evaluations, and really embed it as an important organizational strategy and priority. Every day I wake up and I recognize and I reorient myself through some mindfulness. I'm like, my job is to care for those nurses, those providers, as they care for our patients. And the way that I care for them, think about them, work to put things in place to support them, it will always be reflected in the care that they deliver to patients. So what I'm so proud of what they deliver to patients, I need to make sure I'm wrapping that as well around them. It's structural, it's organizational. There's so many different ways and so many evidence-based ways to put nurse well-being into an organization.
We often don't talk about strategies for career longevity. And my sense is that when we are providing opportunities to care and deliver it in different ways and to be part of different teams, that this is another way to address the career longevity, the endurance. I'm curious are you seeing that? Is this something that you're putting into practice using secondment models or sabbaticals or putting people on different teams for a certain period of time or moving them laterally? Like, what are some of those things that organizations can do to address not only the career longevity, but also the advancement? I mean, these things, we want nurses to be, as you mentioned, agile. Well, they get agile by learning to work in different teams and working with different tools and working in different locations or conditions.
From my learned experience, I can tell you that the most engaged nurses who we have are those who have opportunities to participate because they embrace those opportunities. In 2019, MinuteClinic achieved ANCC Pathway to Excellence designation. And that is a designation that I am super proud of. And it really signals our work and the outcomes of that work to create a culture of nursing practice excellence. And there are a lot of pieces to that, opportunities for development and quality and transformational leadership. But a big part of that work and the engagement and the driving of the culture was around creating opportunities for our nurses to experience different roles and learn new skills. And a lot of these ideas came from our practitioners. So we did things like create peer mentor panels. We created a program of virtual collaboration where across the country, practitioners can connect and network with other nurses. And we have a team of nurses who lead this work using HIPAA-compliant iPad technology. We have a fellows program for our most tenured and accomplished MinuteClinic practitioners. And they put together a whole mentorship program that they just launched where they're mentoring new practitioners who've joined a MinuteClinic and put together a robust program complete with pre-surveys, post-surveys, data collection. We have practitioners who serve as project ambassadors, champions. We give stretch experiences where we have opportunities for providers to move into a different role for a few months, maybe perhaps a manager role, and develop skills. And that's with mentorship and support. We've created Emerging Leaders program that has curriculums and experiential activities as part of it. And I can tell you that it is such an engager. And in addition to developing skills and being engaged, it also enables nurses to really see how things work in an organization, the complexities of healthcare. You not only develop your future leaders and you create talent pipelines and succession planning, but it supports engagement, it supports retention, reduces turnover. And as a nursing leader, to me, it's really important, not only because it drives the health of the workforce, which is tremendous, and the investment that is made in nurses. Yeah. But the other thing is it translates into a quality patient experience.
Yeah. Yeah. I feel like we are better clinicians, better stewards, better people when we have a system-wide understanding of how all of these pieces come together. We all play a very important specific role in that, but it's the sequencing of it. It's the how things can move through and pass through so many eyes and hands and skill sets that it gets reliably and safely delivered. And when we are in part of those different teams and we see those different pieces, it helps us to understand our role and other people's role. It elevates the teamwork, the respect.
It builds trust.
Yeah.
So many times, especially, maybe I'm out in the market and I'm touring and visiting, and, I'll talk with a provider who's had an experience to be part of a team or be part of a group of subject matter experts who perhaps, maybe our quality director is tapping into, and they'll say to me, I had no idea how many people and the talent of the people behind the scenes who work on this, or I had no idea what the process was to bring things to fruition and then bring it into the clinic. And I would say healthcare, especially in a large organization like ours, it's complex. There's a lot of partners, and lots of times those partners behind the scenes, our technology partners, for example, are such an important part of the work that we do that sometimes there's a risk of our frontline healthcare workers not understanding, like, what does all that look like, and what are they considering, and how do they get their data for decision making, and how is our voice included in that? And when they realize, when they have those experiences and they experience, because you can tell them, but when they experience it firsthand and they interact with these folks, and everyone cares about the patient and the provider. Our heart logo extends not only from our front patient care delivery providers and nurses, but to all of our colleagues who put heart into everything they do because they know ultimately it's going to touch every patient. It instills trust. So it's engagement on the part of the nurses. It's trust in the organization that we have your back. We're listening. We're being thoughtful. We're ticking and tying. We're purpose-driven.
Angela, your enthusiasm is infectious in the very best possible way.
Very sweet.
Oh, the energy that you bring to this. And I know that this takes a lot of energy. And I know that it will translate for people listening and who at this moment in time really need something to lift their spirits and to know that there are people who are in leadership roles who see them, who understand them, who care, and who are actively doing things and embracing strategy and bringing partners in to make the system work better for them as care providers and people in our communities who are seeking the care.
It's amazing how I would say probably one of the biggest surprises for me when I first joined MinuteClinic almost 15 years ago, and we just had a handful of clinics and a handful of states, was how willing nurses were to embrace a novel, disruptive site, and really just understood that. And I learned this as well on my medical mission trips. There's so much about care that's about the provider, the nurse, and the patient. And that the closer you get to delivering that in the community, the more meaningful it is for the patient and the more impact you can have.
Nurse executive and purpose-driven innovator Angela Patterson is vice president at CVS Health and the chief nurse practitioner officer at CVS Minute Clinic. In this role that she loves and puts all her heart into, she's responsible for providing clinical and professional practice governance for the more than 3,100 nurse practitioners and physician assistants who staff more than 1,100 retail medical clinics across the U.S. Angela starts every day with a commitment, no, actually an obsession, to care for her organization's nurses and providers, just as they care for their patients and their communities. She supports them at the organizational level, knowing full well it will always be reflected in the care that they deliver to patients. And with every organizational program and initiative, Angela demonstrates just how many structural and evidence-based ways there are to include well-being as an organizational and strategic imperative. The Accelerating Nursing Transforming Healthcare report, along with many reports issued in 2021, call urgently and definitively for every level of health authority to protect and invest in our healthcare workforce. As the World Health Assembly met in May of 2021, the Director General of the World Health Organization called on countries to invest in healthcare workers, nearly 50% of whom are nurses and midwives, saying that the pandemic had reminded everyone that these are incredible people doing incredible jobs under incredible circumstances. He went on to say, "We owe them so much, and if we have any hope of achieving a healthier, safer, fairer future, every member state must protect and invest in its health and care workforce as a matter of urgency." When COVID spread across the planet and Angela's team had to respond, their first action, as Angela described, was to ensure the safety and well-being of their clinical team. Then secondly, she said, was being there for our patients and responding to their changing needs, which meant continually assessing national and community needs and launching new services to meet them. As she recalls, all of that was new. There wasn't a footprint for it. It was about being agile, being innovative, willing to be bold, take some risks and learn as we go, and understand that the need our patients had was immediate and that learning as we go was the right strategy. Listening to Angela, you can hear and feel where the Minute Clinic logo gets its strong and caring heartbeat. In case you missed it, be sure to listen and share the first 2 episodes in our Reporting Powers series, Rehearsing the Future, where we dig into the special character and ambitious nature of the Accelerating Nursing Transforming Healthcare report and the role other authoritative reports play in generating ideas, inspiring change, influencing legislation, driving innovation, and promoting health equity. And our second in the series, Insights in Action, a listening adventure of beautifully told stories revealing how the pandemic changed access to care, changed care needs, and impacted the well-being of the healthcare workforce. And we gain a better understanding of just how nurses are accelerating nursing and transforming healthcare. Stay tuned for our next installment of Reporting Powers. For See You Now, I'm Shauna Butler. Thanks for listening.
Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Learn more at seeyounowpodcast.com.